In the last module, again, talking about injury reporting and record keeping. In the last module, we talked about the 1904 regulations. That's where all the federal regulations are when it comes to injury reporting and record keeping. Talked about the role of the safety professional, why this is important for us as safety professionals. We talked about the characteristics of companies that are required to comply with record keeping regulations, and that's most companies with more than 10 employees are required. But there are exemptions. We talked about those exemptions. Then we started talking about recording criteria, or what makes an incident a recordable injury or not. And is it work related? I mean, it's got to be work related. That's really kind of a no-brainer. But there are some exceptions, and I misspelled exceptions, it looks like there, so please forgive me for that. There are exceptions. There are some situations that may occur in the workplace, but they end up not being considered work-related. We went through several examples of those situations. And one thing I didn't mention, all of those examples, that's almost word for word from the regulations. This isn't my opinion when it comes to those particular exceptions. That's clearly spelled out in the 1904 regulations. And that's pretty much true for everything I'm going to be talking about in this unit. One of the few units where I'm following the regulations almost to the letter. Now I'm rewording it, taking out some of the OSHA jargon, and hopefully making it a little easier to understand. But most of it is, we're by the book in this unit. So let's go ahead and continue our discussion of injury reporting and record keeping. Another criteria that would make a case a recordable case is that it's a new case. Employee has not had a recordable injury or illness of the same type affecting the same body part. If the employee has not had a similar recordable injury, then it would be considered a new case. Variation on that. Employee had a previous injury of the same body part and the same type of injury, but it had completely healed with a full recovery. Then if that's the case and that body part is re-injured and it's the same type of injury, that would be considered a new case. Now, if you have a work-related illness or injury with recurring or chronic symptoms, it does not have to be recorded each time those symptoms show up. Each time those symptoms are manifested, it doesn't mean you have to record a new injury. An example of this might be an employee who's been diagnosed with silicosis, or maybe they have, now silicosis is a good example. Silicosis can come and go. They can have good days and bad days, or maybe good months and bad months. But once it's diagnosed as silicosis and it's recorded as a work-related silicosis, that's the only time it has to be recorded. All right, let's take a look at more specifically what makes an injury incident or an incident recordable. This is assuming it is work. We've established that it is work-related and it is a new case. Death of an employee certainly is recordable. Injury or illness resulting in the employee being unable to work. They lost work days, or lost work days is the common term in the profession for an injury or illness that prevents the employee from working. They're unable to work because of the injury or illness. Also, an injury or illness resulting in the employee being unable to perform their normal work duties. That's a restricted work or a transfer case. Restricted duty or transfer case. That is recordable. And the key there is, and let's clarify this just to make sure, they're unable to perform their normal work duties. If they have an injury that's work-related and it's a new injury, but it doesn't prevent them from doing their normal work, then it's not recordable. For example, let's say a crane operator suffers a pulled groin muscle. They go to the doctor. I mean, it's work related. It's a new case. They got a pulled groin muscle. They go to the doctor. They're diagnosed with a muscle pull. The doctor gives them restrictions for how much they can lift, how much bending over, or they can't lift and bend, something along those lines. But that restriction does not prevent them from operating the crane, then it's not recordable. So there is a distinction there. And this is it. If they're unable to perform their normal work duties, they have to be transferred or they have to be restricted, and that restriction affects their normal work duties, that is recordable. Medical treatment beyond first aid is recordable. And we'll talk about what's considered first aid, what's considered medical treatment in subsequent slides. If there's a loss of consciousness, that's an automatic recordable. If you have a worker passes out on the job, and if you determine that it's work-related, if it happened on the job, chances are it's going to be work-related unless it meets one of those exceptions that we talked about previously. And chances are it's going to be a new case also. If they lose consciousness, that's pretty much a slam-dunk recordable injury. Also, if there's a diagnosis of a significant injury or illness, even if the worker does not lose work days, even if the work is not restricted, even if there is no medical treatment provided, the diagnosis of a significant injury or illness is recordable. And let's use silicosis as an example. A worker goes in, he's having trouble breathing. Doctor does a chest x-ray and some other tests, and he's diagnosed with silicosis. Now, the doctor doesn't tell him he has to stay home from work. The doctor doesn't tell him that he's restricted in any way. The doctor doesn't give him any medical treatment for the silicosis. Just says, hey, you got silicosis. Just that diagnosis of that significant illness is enough to make it a recordable injury. Another issue that you may run into as a safety manager, I've ran into this several times in my career. There's some people that you'll work with, they think that going to the doctor automatically makes it a recordable injury. That's not true. Going to the doctor does not make it recordable. First aid can be administered at a clinic or hospital or emergency room by medical professionals. If it's considered first aid treatment, even though it happens at a hospital, it's still not going to be a recordable. Going to the clinic alone does not make it recordable. If you go to the doctor and they perform diagnostic procedures, but they don't find anything wrong with you, they do a general examination, they take x-rays, they do blood tests and other tests, but they don't find anything wrong with you and there's no diagnosis, that's not recordable. It's only recordable if the tests are positive, if the doctor finds something wrong and makes a diagnosis. So don't be afraid to take injured workers to the doctor because you think it's going to automatically turn into a recordable. If you let's say a guy gets hit in the leg with a 2x4, take him to the doctor, get the x-rays, and the x-rays are negative, showing no broken bones or no significant injury, then it's not recordable. Okay, now let's talk about, again, if it's medical treatment, it's recordable. If it's first aid, it's not. So let's talk about what's considered first aid, what's considered medical treatment. The use of non-prescription medication at non-prescription strength is not recordable. So if you go to the doctor and he says, here, take 2 ibuprofen, go down to the Walgreens or Walmart, get you some ibuprofen, take 2 of them every 8 hours. That is a non-prescription medicine, and that is a non-prescription dosage. So that would not be recordable. On the other hand, if the doctor gives you a prescription for 800 milligrams of ibuprofen and you have to go to the pharmacy to get it filled, 800 milligrams is not a normal non-prescription strength. That would make it recordable. So, and that goes, work with the clinics and go in and try to persuade them to work with you. If there's only non-prescription medication that's needed, try to persuade them to do what they can to help you prevent that being a recordable injury. Yeah, and there's the ibuprofen example. Now this next one, also, I've ran into this a couple of times. At Kiewit, there was a project manager, the most recent. He was under the impression that a tetanus shot would make it a recordable. Again, Kiewit, they are so gun shy. It's all about the recordables at Kiewit. So he had a guy that had a cut, and he was treated at a clinic, and it wasn't going to be a recordable, even with the tetanus shot. But he didn't let the guy have a tetanus shot because he didn't want it to be a recordable. Tetanus immunizations are considered first aid. It's not recordable. Now, some other immunizations, let's say we have a guy get bit by a skunk or a dog on the job site, and he has to take rabies shots. Rabies, that type of vaccination, that type of medication would be considered medical treatment and would be recordable. Now, when it comes to tetanus, and some of you have heard me say this before, or maybe even said it in this class, if you're working in an industry where the workers come into contact with the soil, construction work, landscaping, agriculture, oil and gas, those workers should have a periodic tetanus booster. And I'll leave that to the doctors to determine what would be the appropriate interval. I've heard some people say every 5 years. Some people say every 10 years you need a tetanus booster. But leave that, the physician will make sure that you're getting the tetanus boosters at the proper intervals. Leave that to the medical professionals. But nothing wrong with the tetanus shot. If you have an employee go in, maybe they step on a nail and doctor wants to give them a tetanus shot, no big deal. That's not going to make it a recordable injury. Now, if the worker steps on a nail and the doctor gives him a tetanus shot and also gives him a prescription for antibiotics, the antibiotic prescription would make it a recordable. So that's something else that maybe you could try to manage if you really want to avoid a recordable. And a nail puncture that's one of those cases. Earlier in the semester I talked about cases that should be examined, treated by a medical doctor. I would put nail puncture in that category because of the potential for infection, the tetanus bacteria or other microorganisms infecting that wound, that puncture wound. It's hard to clean, hard to treat with first aid sometimes. So that might be one of those injuries you want to go ahead and have checked out, even though it doesn't seem that serious. Let's talk about cleaning wounds and covering wounds and what's first aid and what's medical. Cleaning, flushing, soaking the skin surface or surface wounds is considered first aid and not recordable. Covering a wound with a Band-Aid or gauze and tape or even butterfly bandages or even different types of adhesives to close the wound, that's all considered first aid. A cut only becomes a recordable when stitches or staples are used, when they actually have to penetrate your skin to close that wound. A staple penetrates the skin and stitches penetrate the skin. Until they have to do that, it's not recordable. Eye treatment. If it's an eye injury, say a worker got something in their eyes, you take them to the clinic. If all the doctor does is flush the eyes out to remove the foreign object, it's not recordable. Or maybe they use a swab to remove the object. The object is on the surface of the eye. That's not recordable. If the doctor puts an eye patch or eye patches to cover the eye, if that's part of the treatment, that's not recordable. Now, where an eye injury becomes recordable would be if an object is embedded in the eye and they have to use tweezers or some other device to pull that object out of the eye. That's a medical condition, that's a medical treatment, and it would be recordable. Also, if there's any kind of prescription medication that goes along with an eye injury, that would make it recordable. Prescription drugs automatically make it recordable. Even if the worker goes back to work, they're not restricted, they don't miss any work, everything is good, but if they got a prescription, that's recordable. Now, when it comes to the treatment of bone injuries, joint injuries, or soft tissue injuries, hot or cold therapy alone is not first aid. Is first aid. It's not recordable. Massage therapy is not recordable. A temporary immobilization device like a backboard, a collar, or a splint that's used for transporting an injured worker, that doesn't make it recordable. If they use an ACE bandage or some other type of elastic bandage to wrap up an ankle or a knee or an elbow that's been injured, if that's all they use, that elastic bandage and tape, that non-rigid support, that's not recordable. But the minute they put a rigid support, a cast or a brace with rigid support that prevents movement, that makes it recordable. Now, there is one type of rigid structural support. A finger guard can be used, and it's not going to be a recordable injury. If a worker has a finger injury and the doctor uses a finger guard to protect that injury and to keep the worker from moving that finger, bending that finger, that is not a recordable. Again, if that's the only treatment, if that's the only type of treatment, the finger guard, that's not recordable. Now, some other treatments considered first aid. If there's a splinter or a foreign object in a part of the body other than the eye, that can be removed with tweezers, and that's considered first aid. If they need to drill a fingernail or a toenail to relieve the pressure, or they have to lance a blister or pop a blister, that's considered first aid. If they administer fluids for heat stress, that is also considered first aid. Right, if you have any questions about any of this, feel free to let me know. And also, I would refer you to the 1904 regulations if there's something that is not clear. But again, I'm here to answer questions when I can. So text, call, email.